preservatives and chemicals and all that. So they are growing up on this. So what is the impact on it on our physiology and how the pathology is developing? This overuse of chemicals, suppressed symptoms, multiple overlapping diseases. I had a patient of cancer having three different cancers, primary cancers in the three different organs. Also having lung fibrosis. And over and above had HIV. For example, a patient comes with severe heartburn, and patient said that I am just popping antacids since last 5 years. If you try to give deep constitutional remedy right away, it's going to fail because there is an obstacle. The obstacle to a disease, what we have learned in our aphorism. Here you have to use it practically. Because body's self-healing mechanism has been blocked by this frequent use of medicines. So what doctor will do it? What we give it? We always first, for example, if it comes to me, I always give dose of Naxomica first, and then we start the treatment. For example, in COVID, I was fortunate that I have a friend who was in VS ICU. She was ICU in charge, and fortunately anesthetist, and she was pro homeopathy. So every day she will call me and describes different cases. એક 12 વર્ષનો છોકરો આવ્યો છે અને એને અમે અમદાવાદમાં વેન્ટિલેટર પર મૂક્યો છે. વોટ યુ કેન ડુ ઇન ધીસ? પેશન્ટ ગરીબ છે. ઓર 25 વર્ષનો છોકરો છે, એના લંગ્સ ક્રિટિકલી ડેમેજ થઈ ગયા છે. વોટ યુ કેન ડુ ઇન ધીસ? Because and she said કે હું અહીંયા આઈસીયુમાં છું, you send the medicine, I'll see that I give the medicine. So I had the opportunity to treat patients in ICU in COVID. So I went through the different symptoms of a Matryonica, and I have decided my own protocol in such cases because it was critical patients. I remember one 31 વર્ષનો માણસ VSના ICUમાં. Patient was on high steroids. Patient already was given remdesivir. Patient was already given tocilizumab. Patient started having convulsions. 6 to 7 convulsions per day, and started developing cardiac arrhythmia. દિવસમાં એકવાર તમે ડીસી આપવું પડે અને હાઈ ઓક્સિજન વેન્ટિલેટર. અને પેશન્ટે આ જે મારો ફ્રેન્ડ હતા એને કીધું કે આને બચાવ. This patient was referred to homeopathy. What we can do? So I went through this. મેડિસિન પર કેવી રીતે આપવાનું? વેન્ટિલેટર મોંમાં છે, કન્વર્ઝન આવે છે. So I gave it in a liquid form, 1 ml medicine. Of course, here I followed the homeopathy principle and used 3 medicines, 1 ml at a time, in 5 cc water, pushed inside the rice tube. 2 hours surprise, after 3 days, the convulsion stopped. Another 2 days, DC cardiac arrhythmias stopped. Patient was in a sound situation. धीरे धीरे ICU in charge doctor had guts to reduce the ventilator લોડ અને વચ્ચે વચ્ચે ઓફ વેન્ટિલેટર કરે. પેશન્ટ વોઝ સક્સેસફુલ, ઓફ વેન્ટિલેટર સક્સેસફુલ. સો દે ડિસાઇડેડ કે આને જલ્દીથી આપણે વેન્ટિલેટરમાંથી બાયપેપ પર શિફ્ટ કરીએ, which was done. As patient improved and went to the BiPAP situation, the relatives became greedy કે આને હવે આપણે સરસ પ્રાઇવેટ મોટી હોસ્પિટલમાં લઈ જઈએ તો ઝડપથી બહાર આવી જાય. And they decided to shift the patient. They went ત્યાંથી લઈને કેડીમાં લઈ ગયા. I told them કેડીમાં દવા નહીં આપવાની. You do not shift. BS SVP is capable of handling and giving you a patient alive and make sure કે તમે જીવતો તા છોકરો પાસે ઘરે પહોંચે. But they went. They wanted to give the best treatment to their father. કેડીમાં લઈ ગયા. Father 32 years. કેડીમાં દાખલ કર્યો. The first thing they did, they stopped homeopathy. They started again back to ventilator, and after 4 days, the boy expired. So, કહેવાનો મતલબ છે homeopathy has power to work in ICU also. The only thing, when you apply your homeopathic mathematical knowledge logically onto the case. I used kali iod, bothrops, veratrum viridi, gelsemium, bromium quite often in COVID cases. D-dimer extreme high hoy, bothrops ચાલુ કરી દેવા. Bothrops has brought the D-dimers very rapidly. Krupali is evident these cases during COVID time. Veratrum viridi, lung affections with heart affections. Many cases had a very damaged lung, but their blood pressure shot up very heavily. They responded very well with veratrum viridi. Bromium I had given, or even Kali Brom also I had given to a young male. કંદુ એના જમાઈ 28 વર્ષનો હતો અને એને લંગ કોલેપ્સ થઈ ગયા, વેન્ટિલેટર પર હતો અને બાયપેપ સાથે જ એને ડિસ્ચાર્જ કરે, વેન્ટિલેટર સાથે ડિસ્ચાર્જ કરે ઘરમાં, સોરી બાયપેપ સાથે કર્યો જીવરાજમાંથી. could not live without that. So I just went there and એને કીધું કે ભાઈ કાઢી શું થાય છે, ઉધરસ કા શ્વાસ લે અને શ્વાસ કાઢ. Bromeo is very strong, coughing on expiration. So, and if it is associated with very expectorations, sticky, I use Calibro. These are the minor logic I applied, and I very good results we got it, and we brought the patient out. Yeah, please.
There was my patient, head nurse Sada, koi hospital ma. So she was reluctant to get admitted in hospital. એટલે એને SPO to around 80, 70, 80 એવું રહેતું હતું. એટલે મેં પહેલાં ટ્રીટ કર્યું તો એસ્પિડોસ કરવાને આર્સેનિક ને એવું બધું આપ્યું. પછી તમને યાદ હોય તો બધું સર આપણે વિડીયો જોઈએ કે શું આમાં she was not improving in that medicines. પછી તમને મેં કોન્ફરન્સ કરીને આપણે વિડીયો કોલ કર્યો તો કશું બીજું કંઈ હતું નહીં, પેશન્ટ વોઝ લાઇંગ ફ્લેટ, એકદમ સ્ટ્રેટ. આઈ ડોન્ટ રિમેમ્બર ધ મેડિસિન. તો પછી તમે પૂછ્યું કે કેમ આગળ છે, શી વોઝ નોટ મૂવિંગ ઇવન. સેચ પોઇન્ટ્સ લાઈક ધીસ.
ના, હોમિયોપેથી ઇક્વલી આઈસીયુમાં પણ કામ કરે છે. હોમિયોપેથી when it acts on the bullseye, it works faster than antibiotics. This is the sutra, you take it for granted. The only thing you have to see that it hits the bullseye. And this, nowadays, allopathics are also knowing this, that homeopathy works faster. તમને કદાચ ઘણા લોકોને ખબર જ હશે કે now the homeopathy, this medical new education policy ની અંદર the internees, allopathic internees are exposed to 60 hours of Ayush lectures. Internees એ homeopathy ના lectures ભરવાના. Neerav is going regularly to give this lecture. I also had an opportunity to give lecture to internists at VS hospital and tell them what is homeopathy. એટલે એમના ગળથુથીમાં તાકો કે ભાઈ હોમિયોપેથી કામ કરે છે. સો they do not tell anybody કે અમારું કામ કામ નથી કરતી, કશું કામ નહીં કરે, તમે આમાં જ રહો. They have to tell કે no, we are not able to treat, you go to this other science, they will help you. Another is talking to the patient and building the trust. You have to now be very clear and honest and very logically replying to the patients. તમારી પાસેથી હોમિયોપેથ ના રિફર થયેલા પેશન્ટ પણ આવશે. પેશન્ટ આવીને કહેશે કે સાહેબ મેં એક્સ દવા આપેલી છે, કારણ કે એમને ખબર છે કે જેની પાસેથી આવે છે ને એ તમારો મિત્ર છે, તો કદાચ તમને એમ કહેશે નહીં, કારણ કે એ મિત્ર છે કે તમારા બે વચ્ચે ઝઘડા થાય. પણ દેન પૂછતા ખબર પડે કે કોની પાસેથી લીધેલી, ઓર સેમ વે આપણા પેશન્ટ બીજે જતા હશે. So this happens. So we have to be very careful, and you have to be. And again, Google also gives you lots of information about homeopathy to the patients. Lots of myths are being spread about homeopathy. So you have to give very clear reply to it. I'll just share one case on this. This is a case of a lady doctor who is a fetal medicine expert. She is almost 34, 35 years old, very successful fetal expert. Year ago she came with a severe vertigo with tinnitus, which was bothering and hampering her work. આજે આખો દિવસ એ લોકોએ સોનોગ્રાફી જ કરતા, અને સોનોગ્રાફી કરી અને પ્રોબ લઈને આમ નીચે જોઈને કરે એટલે એને ચક્કર આવે, એટલે એના બધી પ્રોબ જ પડી જાય. And she was accompanied by her husband who was a neonatologist. Her husband and wife બંને allopath, was treated by homeopath and burned because of the answers and the way of handling, and now coming with a new hope. So your responsibility increases. The doctor was already treated by her friend who is a senior lady homeopath at Surat, but had a very experienced severe aggravation of vertigo. She had mentioned to her that she is having severe aggravation from alcohol. એટલે કે મેં મારી ફ્રેન્ડને કીધું કે મને આલ્કોહોલથી એગ્રેવેટ થાય છે, એટલે પ્લીઝ મને એવી દવા ના આપી કે જેમાં આલ્કોહોલ હોય. કઈ દવા તમે આપશો જેમાં આલ્કોહોલ નથી? She had become skeptic of homeomedicines since last experience. મને એવી દવા આપજો જેમાં આલ્કોહોલ ના હોય, ને તો હું દવા નહીં લઉં. She is a fetal expert, so every day she had to do multiple sonography, taking probe, leaning onto the patient, and it develops vertigo. As soon as નીચે નમીને જેવી ઉપર આવે એટલે ચક્કર આવે, and everything will spin. She feels that she will fall down though she is sitting. Vertigo aggravates from looking up. Even in bed, सूती होए, आम सुए तकिया पर माथुं मूकीने चक्कर આવે. She has to turn and sleep on one side. Many times she wakes up because of the vertigo. As soon as ઊંઘવામાં પડખું ફરીને ચતી સુએ તો એમાંથી પણ જાગી જાય, એટલા severe. So it was not a psychosomatic, it was a real positional vertigo she had. She also had a severe tinnitus episode, intermittent with vertigo. Even before this vertigo episode, she has this tinnitus. So both this vertigo with tinnitus and this tinnitus of positional has a different cause. By end of 23, she had a vertigo followed by heaviness of right ear and with tinnitus. Again she developed the tinnitus. Now episodes of vertigo, that is positional one, had since 2014. આ એને 23 માં ચાલુ થયું, ચોવીસમાં 2014માં ઓલરેડી એને ટીનિટસ હતું. She consulted ENT, neurophysicians, was given oral steroids, but that has developed gastritis. So this gastritis is again part of this her axis of symptoms development. She had a motion sickness in the childhood. Why it started? This why is very important in homeopathy. How, why, what. These are very important in your case taking. Unless you solve this why, what, how, you will not get the real cause and you will not able to connect the different threads in case taking. She said that when she had lots of night emergencies and had a less sleep during her MS Gynec, and after that it has started. There was a sleep deprivation, it was the strongest factor, and also aggravation from the homeopathic medicines. She used a very strong word. Sir, तुम्हारे homeopathy मारे case बगाड़े हैं. She was a word she has used it. She was a very studious, responsible, work-oriented person. Her workaholic and sincerity of work. Recently, she just gave an example. हमारा जो बहुत बरसात पड़े हो तो, यार she had to, there was some congenital metabolic case, so she has to go do the sonography in a pregnant lady at Mayfair VHR. For that, another senior doctor with whom she has learned fetal was invited from Chennai. So Chennai doctor was on his way to flight and landed at Ahmedabad airport. Ahmedabad airport पे कहते घुटन सुधी ना पानी. At Vijay Charasta, it was a छाती सुधी ना पानी. So both these senior doctor पानी में चाहता चाहता बे फ्लेवर आ गया, 4 माला चढ़ीने ऊपर गया, અને પેશન્ટ ની સોનોગ્રાફી કરી. The senior doctor said, મને ખબર જ હતી કે આટલા પાણીમાં પણ તું આવીશ, કારણ કે the time you were studying with me, I had the impression that you are very sincere and workaholic. So these I'm just narrating her sincerity, responsible and workaholic. Losing her temper if schedules are not maintained, particularly in a clinic. So what medicine you can take? Great. Was given Cocculus indicus. Felt less vertigo, but her GERD, the reflux, kept coming up issues. Reflux was another, as I told you, added to her axis of developing complaint, which was especially spicy food थी है. So I had to rethink on this. જ્યારે પેશન્ટ આવી બી ધમકી આપી હોય તો તમારે બહુ સ્કેપ્ટિક તમે જાતે મગજમાં બહુ વિચાર કરવો પડે. The medicine was I had to change. As per a complaint, I observed the axis. જ્યારે પણ acidity થાય ત્યારે tinnitus થાય અને vertigo. This was a very strong axis I had seen in a case. Now which medicine? Sorry? Okay. I agree with her. I gave Naxomica 200. She responded very well to this. Her GERD reduced drastically. So was her vertigo. Now, urine potency also was a problem too. You know, we use zero alcohol for giving placebos. Patient અમે કહે છે સાહેબ તમે અહીંયા જે ખવડાવો છો ને એ ભીની હોય છે, ઘરે આપો છો ને એ સૂકી હોય છે. So તમે placebo આપો છો. This was the word patient told me directly. And As we know, homeopaths are very smart in convincing people. ऐसे ना नहीं दवा अंदर मेडिकेट થઈ ગયો અને પછી ધીરે ધીરે સુકા થઈ જાય આપણી જેમ. So પેલી કે આ તમે જે કીધું ને એ બરાબર છે. આ વસ્તુ મેં મારી પેલી લેડી હોમિયોપેથ જે ફ્રેન્ડ છે એને મેં કહ્યું હતું કે પ્લીઝ તું કોઈ એવી દવા મારી સામે ના નાખતી. એણે મારી સામે જ અંદર પાછી દવા નાખી અને એ દવા મને આપી અને પછી જે મારો એગ્રેવેશન થયું છે મેં એને કીધું કેમ આવું થયું એટલે કે મારથી ભૂલથી વધારે દવા પડી ગઈ હશે એટલે આ તને થયું છે. But that has made her skeptic that I told you that I have aggravation from alcohol. Why you put it? So for me, it was very safe. મારી માટે તો alcohol મારું બચ્યું. So I used to give plain pills. I said, okay, as you are burnt with homeopathy, I'll give you a minimum dose. Take this one dose right now, and rest you take only one time in a day in the morning. Okay, bas aa garnu na. So that has given her confidence, and she took the medicine. જ્યારે પણ મને લાગે કે I have to repeat the medicine, I convinced her to use homeopathic dilution, give a dose. આવી બોટલ લઈને આપી દીધી કે આમાં પાણીમાં હોમિયોપેથિક આ મેડિસિન ડાયલ્યુટ કર અને આમાંથી એક એક ચમચી દિવસમાં 3 ટાઈમ લે. That has helped her. So either her constitution is very sensitive, what we call idiosyncrasy. Idiosyncrasy, if you remember a short note asked in a philosophy, write idiosyncrasy 5 marks. And since last 6 months, she is not having any vertigo nor GERD. In spite, 15 days back, she went to Udaipur for her fit and medicine conference. She had her presentation at 10 p.m. at night, which went up to 12 o'clock. She slept at 2 o'clock, and still she responded, there was no problem. The confidence how she got the homeopathy is last follow-up she came with her father. Dr. Ahmedabad. So allopath bringing their own relative shows confidence in homeopathy.